Do you ever wonder why some people can drink more than others and not seem affected? Do you ever wonder why some people can smoke one cigarette when they go out to a bar, but they don't end up smoking on a regular basis? Or what about those people who use cocaine one time and then they get addicted for life? This module is going to look at the idea of addiction to substances, and we're going to end the module with a very brief section on treatment options. Please look out for the motivational interviewing module that will go into greater detail with one of the treatments available for people who are trying to stop using substances. Isn't the substance a thing that the person's intentionally putting into their body? Can't they just not put it into their body and not be addicted? The complicated thing about addiction to substances is that everybody's reaction to a substance is different. For a given substance, there are going to be people who don't like it at all and never try it again. There are going to be people who try it and find the results to be okay, and they're willing to try it again one day. And then there are people whose lives shift completely after trying the substance. Like any other illness, there are factors from someone's biology, psychology, and social circumstances that come into play. Biologically, some brains are more likely to get addicted to certain substances, and neuroscience is moving closer to figuring this out before anyone has an opportunity to experiment on themselves by trying a bunch of substances and seeing what happens. To go a bit further, once a brain is routinely exposed to a substance, the brain itself changes. What might have been voluntary and fun becomes a habit that's incredibly difficult to break. Psychologically, different substances may fill different voids in a person's life. Maybe there are memories that they're trying to forget or dampen. Maybe they have a need for excitement that's missing from their lives. Socially, there are all kinds of pressures in life that can impact substance use. I'm not just talking about peer pressure to use substances with friends. I'm also talking about stresses from work, relationships, or school that encourage someone to seek refuge in a substance. So when you look at substance use through the lens of biology, psychology, and sociology, the problem ends up looking a lot more like other illnesses such as asthma or diabetes. Well, first of all, the term addiction is fine to use in common language, but the clinical term now is substance use disorder. So then what is a substance use disorder? That's a condition in which the use of one or more substances leads to significant distress or impairment. We'll look at symptoms of substance use disorder in a minute, but let's talk about distress or impairment right now. If a person starts using a substance and that substance directly impacts their home life, their work life, or their school life, then they may be impaired. Unfortunately, they may not be aware of the degree of their impairment, probably because their attention is diverted elsewhere. So if you ask them if they're impaired, you may not get a useful answer. It might take some digging around to understand how their marriage goes when they drink, or whether they didn't get a certain job because their urine showed something positive, or whether they underperformed on a test because they were busy putting something into their bodies rather than studying. Compare these circumstances with people who use some of the same substances and do not experience a substance use disorder. For example, if you have your wisdom teeth pulled and take a few prescription pain pills on the day after surgery, then you're doing something about your pain. When the pain is over, you get rid of the rest of the prescription and you go about your life. That person does not have a substance use disorder. Or a college student who had psychological testing which showed ADHD. That student is prescribed a medication which helps them focus and helps them perform much better in class. When summer break comes around, they don't take the medication. That person does not have a substance use disorder. Well, as I said, you first need to identify that the person using the substance is experiencing some dysfunction or distress in their daily lives. Then there are 11 criteria. Here they are. Taking larger and larger amounts of the substance, wanting to quit but being unable to, spending lots of time seeking and getting the substance, craving the substance, being unable to carry out work, school, or family obligations due to substance use, continuing to use in spite of recurring problems caused by substance use, stopping or cutting back on work or fun because of the substance use, recurrent use in situations that are hazardous, continued use of the substance even though the person knows it's bad for their body or mind, and withdrawal when the substance is absent from the body. If a person meets 2 or 3 of these criteria, they're considered to have a mild substance use disorder. If they meet 4 or 5 of the criteria, they're considered to have a moderate substance use disorder. And if they meet 6 or more of the criteria, they're considered to have a severe substance use disorder. Let's start with nicotine. The current name for this problem is tobacco use disorder. According to the Centers for Disease Control, 480,000 deaths each year in the United States can be attributed to cigarette smoking. In spite of significant efforts to reduce smoking rates, about a quarter of all Americans aged 12 or older smoke. As I'm sure you know, tobacco use can lead to breathing problems, lung cancer, a bunch of other types of cancers, heart disease, stroke, and other problems. About 88,000 American deaths can be attributed to alcohol each year. Besides destroying your liver, alcohol overuse can lead to certain cancers, bleeding problems, and a host of other physical illnesses. Although about 50% of Americans aged 12 and older report current alcohol use, about 5% of Americans can be diagnosed with an alcohol use disorder. That still leaves us with about 17 million people whose lives are being negatively affected by this substance on a daily basis. Let's talk about marijuana. Now that marijuana is legal in some states, you can't be addicted to it, right? Wrong. Don't confuse legal issues with health issues. Just because a substance is or isn't legal in a particular jurisdiction doesn't change the effect of that substance on someone's life. In 2014, about 22 million Americans aged 12 or older used marijuana in the past month. That's about 7% of the U.S. population. About 1% of the U.S. population would meet criteria for a substance use disorder related to marijuana, or about 4.2 million people. Effects from marijuana on the body include difficulty thinking and long-term memory problems, lung problems, and problems with hormone secretion. Let's shift gears for a minute. What if someone identifies themselves as needing to stop using a substance? What should they do? The good news is that there are a tremendous number of options available to them. The bad news is that we cannot predict which option will work for them until they try that option. The thing to keep telling the person who's trying to quit is that they should keep trying. Relapses are part of the illness and they are expected. Their responsibility is to pick up the pieces if they relapse and try again. It takes patience and persistence. Patience on the part of the person trying to quit, and patience on the part of their support system. As a veteran service officer, your patience and encouragement could go a long way towards helping them on their journey. The most commonly known approach to stopping substance use is the 12-step program. Alcoholics Anonymous and Narcotics Anonymous are the 2 best known of the 12-step programs, and they have international networks. Run by lay people, these programs are amazingly successful for individuals who are willing to participate in the model. But they may not be for everyone. We're not going to go into detail about the AA model, but there are a few things you should understand about this approach and similar approaches. They usually believe that complete and long-term sobriety is the goal. They also believe that most people who use a substance have developed an entire lifestyle that they will need to question. In order to sustain change, these programs expect radical transformation of many aspects of the person's life. A different approach to recovery from substance use disorders is motivational interviewing. Again, we will be spending a great deal of time discussing motivational interviewing, or MI, in its own module. This approach to dealing with a substance use disorder identifies that every person is on a different stage of their path to recovery. Some people are taking action right now. Some are poised to take action. Some are thinking about it, and some aren't thinking about making changes at all. MI could be called a structured method that helps individuals figure out their motivations for change and their motivations to continue using substances. The idea is that by figuring out the unique circumstances in a person's life, they'll be able to direct themselves towards a healthier path. MI has been called non-judgmental and non-adversarial. There's a strong emphasis on meeting the person where they are rather than prescribing a one-size-fits-all approach. A third approach to certain substance use disorders is to include some sort of medication in the treatment plan. There are a variety of approaches to using medications for a variety of substance use disorders. There are medications that can serve as deterrents. Those would make you sick if you use the substance. There are medications that help ease withdrawal symptoms when coming off a substance. And there are medications that can help cut cravings related to certain substance use. Obviously, if a veteran wants to try something along these lines, they will need to see a qualified professional with expertise in this area. When they see that professional, they will probably be told that they need to use medication as part of a comprehensive treatment program for their substance use, whether it involves AA or NA, motivational interviewing, or something else.